Hello, and welcome to the Alabama Public Health Training Network. I'm Brandon Vaughn with the Alabama Department of Public Health. Thank you for joining us for our program today, Title 10 Final Rule, Family Planning Compliance Requirements. If you have a question about anything being discussed today, please call or email during our broadcast. The phone number and email address are on your screen now and will appear again later in the program. Also, the handouts, sign-in sheet, and evaluation are all available online. You will need to register for this program in order to access those materials. Continuing education credits have been approved for nurses and social workers for this program. In order to receive credit for this training, you must watch the entire program, then complete and return the sign-in sheet and evaluation. While content may continue to be relevant, CE credit will only be awarded for 1 year for nurses, expiring on September 30th, 2020, and 2 years for social workers, expiring on September 30th, 2021. If you are watching this program on demand and want to receive a social work CE certificate, you need to complete the social work test and send it in, along with your sign-in sheet and evaluation. If you're watching this program live, there is no social work test required. For social workers, if you are watching this program live, it qualifies for classroom hours. If you are watching on demand, it is considered non-classroom hours. Before we get started, I would like to introduce our presenters today. Beth Allen, Nurse Practitioner Director and Division Director of Women's Health, and Deshette Gordon, Family Planning Training and Outreach Coordinator. Welcome to each of you. I know you have a lot of information to cover today, so let's go ahead and get started with your presentation.
Thank you, Brandon. Our objectives for today's program are identify new and/or revised requirements of the 2019 Title 10 Final Rule, describe how provisions of the Final Rule impact family planning clinic roles, identify implementation strategies for each new and/or revised requirement, identify resources for staff use to promote compliance with the Final Rule. What is the Final Rule? The Final Rule is the set of requirements and the implementing regulations under Title 10 which govern project grants for family planning services. The official name is Compliance with Statutory Program Integrity Requirements, also affectionately known as the GAG Rule. The Final Rule was published on March 4th, 2019 in the Federal Register and was scheduled to take effect 60 days later on May 3rd, 2019. The effective date was delayed by numerous lawsuits and a nationwide injunction. The effective date following a legal victory by the Department of Justice was officially July 15th, 2019. Why do I need to know about the Final Rule? There are several important changes that have taken place, and in order to be in compliance, we need to be aware of those things. Some of those changes are expanded abortion restrictions, pregnancy counseling and referrals, patient fees, documentation requirements when providing services to minors, documentation requirements related to Alabama mandatory reporting law. As evidence of a good faith effort to come into compliance with the Final Rule, OPA required the following of Title 10 grantees: assurance and action plan documenting steps to come into compliance, which we submitted August 19th, 2019. The written assurance states that the project does not provide abortion and does not include abortion as a method of family planning. The action plan describes the steps that we'll take to come into compliance with all aspects of the Final Rule. The expectation is that grantees will begin to implement the action stated in their action plans immediately. This training is an element of ADPH's action plan. Expanded abortion restrictions. A Title 10 project must be organized so that it is physically and financially separate from abortion-related activities. The Final Rule prohibits use of Title 10 funds to perform, promote, refer for, or support abortion as a method of family planning. ADPH has never provided abortions. Staff may not, on ADPH time and/or using ADPH resources, make referrals or assist patients in any way to obtain abortions for family planning purposes. For example, lobbying the passage of pro-abortion legislation or providing speakers who promote abortion as a family planning method. Staff may not, on ADPH time and or using ADPH resources, participate in activities to encourage or increase the availability of abortion as a method of family planning. For example, scheduling an appointment for abortion or providing a list that identifies abortion providers.
Okay, so we're going to go into expanded abortion restrictions and just talk through how we're going to implement these changes. Of course, all Title X staff and subrecipients must comply with this requirement. The activities that we're going to talk through in this presentation include changes to clinical protocol, patient counseling, patient referrals, and all printed material that goes to patients also must be in compliance with Title X program and must comply throughout our subrecipients. Expanded abortion restrictions, how this affects us is very pertinent in distinction between previously what nurses can do and nurse practitioners do combined with non-directive pregnancy counseling is changing. So if non-directed pregnancy counseling is provided, documentation must support that a patient was not assisted in any way to obtain an abortion for family planning services. How are we going to implement this? We're sending out standing orders today. We actually will then, of course, include that in our next protocol revisions. We have sample scripts to help us as providers give the information that's needed to our patients and in response to their question and request. We also will have provider referral resources and community resource directories available to include these changes. We will discuss shortly in the presentation how we will go about non-directive nurse practitioner pregnancy counseling. A common script that we've looked at that all staff should be skillfully made aware of and maybe even keep by the phones for the clerical staff and also at the nurses stations and nurse practitioner areas would be that we would be prepared for any phone inquiries that may come in. Keep in mind that any time that a rule and changes like this is inactive, that auditors also have a keen sense of needing to know if we're implementing these changes. And so we're trying to help give prompts and different ways that you can script that when these requests come in from the patients and or others, possibly by phone and request. So the sample script that we've looked at, I will read. It says, although abortion falls outside the scope of our program under federal law, I can provide you with a list of providers or community resources that serve pregnant women. You can reach out to these providers and agencies to learn about the services they provide. We feel this should be across the board, so this should be at the clerical station for when phone inquiries come in. This should be at the nurses station for when we're counseling patients and in the nurse practitioner areas as well. And we'll go through how we provide these resources a little bit later.
Pregnancy counseling and referrals. Title X funds are intended only for family planning services. Once a Title X client is medically verified as pregnant, she must be referred to a prenatal care provider. Prenatal care is considered medically necessary care. The Title X provider may also choose, but is not required, to provide the following: non-directive pregnancy counseling about any of the options, continuation, termination, and or adoption, any medical questions or counseling beyond confirming pregnancy tests and or factually stating the options available to the client must be referred to a physician or nurse practitioner for non-directive counseling. A referral list of licensed, qualified, comprehensive primary care providers, including prenatal care providers. Title X staff may not identify in any way be it verbally pointing or highlighting which providers or agencies on the list provide abortion services. Referrals to social services or adoption agencies, information about maintaining the health of the mother and the unborn child during pregnancy, federal conscience protection of healthcare providers. Federal statutes protect healthcare provider conscience rights and prohibit recipients of certain federal funds from discriminating against health providers who refuse to participate in certain healthcare services based on moral or religious objections. Under the federal conscience protection statutes, providers may file a complaint if they believe they have experienced discrimination due to their objection to, participation in, refusal to participate, or coercion into participating in certain medical procedures, including abortion and sterilization. The federal conscience protection statutes include the Church Amendments, Public Health Service Act, Section 245, the Weldon Amendment, and the Affordable Care Act.
So let's talk a bit about pregnancy counseling and referrals. Again, all Title X staff and subrecipients must comply with this requirement. How are we going to implement this? What clinical activities will be affected? It will be in our clinical protocol, in patient counseling, and patient referrals, and this is a requirement as well of compliance. Any family planning clinic staff can inform a patient of the results of their pregnancy tests. The distinguishing factor with this change in this rule is that it must be a nurse practitioner and or physician that does family planning pregnancy option counselings. Those non-directive counseling has to be provided by the nurse practitioner and or the physician. So our documentation must support that every pregnant patient is referred to prenatal care. That's also a requirement of this new change. So we will have referral resources. We will post those on the document library so that those are readily available at all times and can be printed ahead. How we're going to implement this, again, through the standing order that goes out today, and that's several standing orders, inclusion into the next protocol, and then some sample scripts that we've tried to help as far as knowing how to say this until you're comfortable with your patient dialogue around this change. We also want to let you know that we have worked with the EHR staff, and we have prompts throughout the EHR that we feel has made this process easier for patient care, and we will walk through those in just a minute. Additionally, we've also made available through the assistance of our social workers a community resource list. So this is a snapshot of how it looks in CureMD when you do pregnancy counseling. And as you can see in this snapshot, this will go into effect Monday, by the way. So just a few days for this to get enacted through the EHR staff. But what you will see is a different drop down than you've had from just the previous pregnancy options counseling. By having this drop down, the distinguishing factor between the nurse practitioner and the nurse is that the nurse can choose any of the items below the non-directive pregnancy counseling, and the nurse practitioner, when is indicated and the patient actually wants counseling further around her pregnancy status, then the nurse practitioner would actually be the one that checks the boxes around non-directive patient pregnancy counseling. So a sample script for prenatal referral is, and this is the referral that we'll have on the document library. It includes the OB providers and PMDs that would serve for OB services. And we can just simply say this is a list of healthcare providers / community agencies that serve pregnant women, and we can simply hand them that and say reach out to these providers about your services.
Patient fees. A woman who has an employer-provided health insurance that does not cover the contraceptive services she desires due to the employer's sincerely held religious or moral objection to providing such coverage may be determined by the clinic director as unable to pay for the service and considered low income. To determine if the woman is eligible for Title X sliding scale discount, the clinic director may consider the woman's annual income minus the total annual out-of-pocket costs of the contraceptive service she uses or seeks to use. The clinic director may determine those costs or estimate them at $600 annually. Confidential services to minors. Unemancipated minors who wish to receive services on a confidential basis must be considered on the basis of their own financial resources, provided that the Title X provider has documented in the medical record the specific actions taken to encourage family participation. Such documentation is not required if the provider has documented that the provider suspects the minor to be a victim of child abuse or incest, and in compliance with Alabama mandatory reporting requirements, a report has been made to the appropriate authorities.
So like Deshette has said, we are going through some fee system manual revisions, which will be shortly finished, I believe, and then we are going to have some EHR prompts that we're about to get into, showing you the changes that you'll have that's needed for this requirement for your documentation. And that is also for the confidential services to minors. So if a patient's financial records indicate that they are a minor patient requested and received confidential services, the clinical record must document encouragement of family participation or suspicion of child abuse / incest and mandatory reporting as required by Alabama law and the Alabama Department of Public Health policy. So we do want family involvement and to encourage that with our minors. That is something that we currently do, but we want to make sure that that is documented clearly for this requirement in all aspects of minor care. You know, oftentimes patients come in and they're minors, and typically a question or a conversation might be, how did you get here today? Who brought you? Who's with you? Those are just some tips about how to get into that conversation, and then to help them to identify family involvement and or parental involvement that would be necessary and important, as we have been doing. We want to continue to do that and document that. Okay, next slide. Yeah, no, yeah, go back one. So I just want to mention that as far as implementation, again, we're going to implement this through standing order, the protocol revision, EHR prompts, which we're about to get into, and this training, which is a one-time training that meets the requirement of this, but it will also be on demand for you to use and to train with forthgoing. Okay, so yeah. So this is the way the EHR screen looks currently when you pull up any type of family planning counseling. This is built into a lot of your notes, but can be a custom form add. And this is going to be necessary, not optional, but necessary now when you're documenting these needs. So where family involvement is checked on this screenshot that you have in Cure, what it will do is prompt a series of responses that are drop downs. Those drop downs will say yes as a marked response. If you choose that, then beside it it says verbal encouragement provided. If it's no, then those are outlined in the EHR template as well. It says, I'll just read what it says as we've put it into the prompts. If you check no on that, it is that family involvement was not encouraged because there is a suspicion for child abuse and reporting that would be mandatory. So that is said for you as you choose that no response. And then if it is no, there's a third prompt that tells you you must go back to the safety questions and be sure that you have also filled those safety questions out. In the case where, and this is a blue hyperlink in your normal pattern of history taking when you're interviewing your patients. In that same family planning counseling section, when you pull it, where we have the 2 check lines for STD, ABC message, and then STD, HIV prevention. If it is a minor, it's going to give you a drop down for you to check as a prompt to go again back to the safety questions to be sure that we're completing those. So we felt that this would be helpful in a checkbox fashion, but you must, in these cases of minors, use your family planning counseling template options here. And you know, because this is a requirement of Title X, of course, this will be something that we will pull into our audits and will be checked in that way to be sure that we are complying with this, as well as federal auditors, when they come, will do the same. Okay. And then we just wanted to talk about the script that you say with minors. And, you know, I talked about that briefly, but just to add, to be helpful, what we came up with is it can be helpful to have a trusted adult that you can talk to about things like dating relationships and pregnancy prevention. And these topics are challenging to you and sometimes confusing. So having someone to talk with is really important, and we want to stress with each minor that this language, and so we've developed a script to help guide you in how to say those things.
Expanded requirements regarding family planning services to minors. In addition to the family participation documentation requirements, every minor who presents for treatment must be provided counseling on how to resist attempts to coerce them into engaging in sexual activities. Any minor who presents with a sexually transmitted disease, pregnancy, or suspicion of abuse must be screened for victimization of a minor.
So again, just talking about services to minors, sexual coercion should not be a new topic to us. It's not a change in the way that we counsel minors, and should only just be, an additional encouragement from this presentation that we will certainly need to comply with all counseling around sexual coercion as you're talking to your patients who are young. The requirements here are listed. The ways we're going to comply are the same ways that we have in the other requirements of this federal change. Okay, so we've talked through the standing order that goes out today, protocol revisions that will go out with the October revisions, the EHR prompts, the safety screening questions, and this plan as a part, or this actual presentation as a part of our action plan to meet that requirement, including topics around sexual coercion.
There are several resources given throughout this program. Just going to list some of them really quickly, and you can refer back to them for future use. The updated fee system manual, a referral list of primary care providers and prenatal providers, sample scripts, family planning clinic protocol manual and standing orders, ADPH abuse and neglect reporting policy, Alabama DHR written report of suspected child abuse neglect form, and of course this Title X training and the other requirements that can be found in LCMS. This concludes our program for today.
Thank you, Deshette. I don't see that we have any questions via email, but do we have any questions in the audience? No questions?
If we don't, I would like to say before we end, since we've got a couple of minutes, I think, We have Carolyn Miller, and she's our social work lead here in the central office around clinical services. And I would like for her just to speak a second on how the directories that the social workers have will be accessible and available to the clinics. Thank you, Carolyn.
Sure. As most of you know that are watching today, there will be virtually no social workers in the clinic that will be available, as we've grown accustomed to over the years. But they are updating their community resource list. It should be completed by no later than the end of this month, or they may have already done so. And they are directed to give that to the clerical staff, the nursing staff, as well as WIC, and anyone else in the building that may need that. They're going to have two lists. They're going to have one for basic community resources, and the other list is going to be providers, just as you mentioned in the presentation today. It'll be a list of providers for prenatal care. It will not distinguish any of those providers that provide abortion services, but they will have that list available, and they will give that to the staff to hand out.
Thank you. Thank you very much. I know that when we do presentations like this, sometimes things need to marinate before questions arise, and in the implementation thereof, which should be immediately, then questions will arise. So please don't hesitate to reach out to us in any way by email. That includes me, the Nurse Practitioner Seniors, Lori Gregory, the Title X Director, Deshette Gordon, our Outreach and Training Director, and any of our staff here that can help you in any way.
Thank you all so much.
Thank you.
Thank you, everyone in the audience. That concludes our program for today. I want to thank Beth and Deshette for being here, and thank you for watching. Please remember that you can refer back to the training and resources anytime on demand. Have a great day.